Psychological loss of appetite. What is psychological anorexia? Is it really psychological or organic? In this article, we will learn more about this type of eating disorder, its causes, and ways to treat it. Psychogenic anorexia or anorexia nervosa is a type of eating disorder, and in this article we will talk in detail about it. Psychogenic anorexia. Definition. Psychogenic anorexia is a type of eating disorder characterized by low body weight and abnormal food restriction behaviors in people with the disorder. This type of eating disorder affects women more than men. But men also may suffer from this disorder, which has two main forms. The first is the restriction of eating habits and excessive exercise. And the second form is through binge eating and getting rid of it. Psychological loss of appetite. Causes. The main cause of psychological anorexia is not specific and unknown so far. But there are many risk factors that may lead to psychological anorexia, including the following: imbalance of some hormones in the body, genetic disorder, social barriers favoring thinness as a desirable trait, external environmental factors, such as the onset of puberty, social relationships, and other events. Psychological factors, including the aspiration to reach the full body, which is accompanied by anxiety and depression. Psychological anorexia. Symptoms. A person suffering from psychological anorexia is not satisfied with his food choices and his physical appearance, and this usually leads to severe weight loss. And the sharp and rapid weight loss and fear of weight gain are the most important symptoms of this group. There are other symptoms that appear on people with psychological anorexia, such as vomiting, abdominal pain, skin discoloration, tired, constipation, hair loss, low blood pressure. Psychogenic anorexia. Diagnosis. According to the Diagnostic and Statistical Manual of Mental Disorders and in the 5th edition, a person has psychotic anorexia if he has 4 criteria, which are: a person with psychological anorexia refuses to gain any weight, including the minimum weight according to height and age, which in this case leads to a decrease in the person's body weight by 15% less than expected. A person with psychogenic anorexia fears being overweight or obese. A person with psychogenic anorexia suffers from a disturbance in the perception of body weight and shape, and a lack of confidence in how people perceive their weight and body shape despite the low weight. Psychogenic anorexia in females accompanies menopause. Psychological anorexia. Treatment. Although the standard treatment of psychological anorexia is through psychotherapy and nutritional intervention, where the doctor advises eating foods rich in magnesium and zinc and avoiding caffeinated drinks, there are also other ways, including psychopharmacological treatments that will accelerate the process of weight gain and reduce weight. Symptoms and abnormal psychological behaviors. Psychological anorexia. Complications. Many complications of anorexia nervosa are caused by weight loss and malnutrition. And the most common types of these complications include circulatory disorders associated with anorexia and hypothermia. Among the complications that accompany the lack of treatment or delay in the treatment of psychological anorexia are the following: anemia, imbalance of body salts, such as sodium and potassium, kidney problems, weakness and osteoporosis, and thus an increased risk of fractures, death suddenly in the absence of these symptoms, as studies indicate that the mortality rate among patients is 6 times higher than the mortality rate of the general population. There is no guarantee that psychological anorexia can be prevented. However, it can be prevented by identifying the early signs of the disease, and in the event of a diagnosis of the disease, it is advised to consult a doctor and not neglect any abnormal symptoms in order to avoid the worst.